The following portion of Arts and Culture is sponsored by Sunshine Meadows.
Good morning, everybody. Welcome back to Good Day Kansas, continuing here in downtown Wichita at the Kansas Health Foundation with the president and CEO, Ed O'Malley. Ed, thanks for having us in today.
It's great to be here. Thank you.
Yeah, one thing I didn't mention is you're also an author now. We have this book here, Leading Health. Tell us about this book.
Yeah, we're so excited about this book. The book is really kind of a call to arms for Kansans. And it's about the fact that Kansas used to be one of the healthiest states in the nation. Back in 1991, we were number 8, and we've been steadily falling. In fact, no state has fallen further in America's health rankings than Kansas. We fell as low as number 31st. That was about 2 years ago. Last year we were 29th. Now we're 28th. The book is about how do we get Kansas to number 1, which is what the Kansas Health Foundation is all about.
Why is a book like this so important to Kansans here?
Yeah, you know, I think people sometimes they take things for granted. They might not know that we used to be one of the healthiest states.
Yeah.
They might not know we've fallen, and they might not know the consequences of that, not just for the health of people, but for our economy, for our kids, for our future in Kansas. So the book is trying to say, look, Kansans need to know about this, and there are things Kansans need to do to improve health. Yeah,
absolutely. So the grand scheme of things, why does it really matter where we fall on that national health ranking scale?
Health is a measure of everything. So America's health rankings, which is what the book is about, it's not just health care. It's schools, it's our economy, it's economic opportunity. So as our health has declined as a state, so has our economic output, so has the opportunity for families and Kansans. We've got to turn it around. That's what the book's all about.
So why have we seen a decline here in Kansas?
You know, I've learned that if you ask a dozen experts, you'll get a dozen answers. And certainly there are some health-related factors, like the number of Kansans who don't have adequate health insurance or health coverage keeps increasing. That's a big factor. But we actually think, and the book is making the argument, that the bigger reason as to why we're falling is we're not paying attention to it. We need more Kansans to exercise more leadership. We think it's a leadership challenge, not a health challenge.
Yeah, so talking about caring more and doing more, how can I or our viewers out here play a part in this?
Well, I think that the first thing is we need the viewers, we need people in Kansas to know about it. We need people to talk about health and to talk about these rankings. Again, it used to be something we were proud to talk about. In the last 25 years, we talk about it less and less because it's not as positive of a story. So we need Kansans talking about the ranking, believing that will propel us to move forward. We also need people sharing the book. The book makes an argument. It tells a story, and we need that story spread.
Yeah, how can people find this book or find more information about anything going on here at Kansas Health Foundation?
Well, if they go to our website, kansashealth.org. /Leading Health, which is the name of the book, Leading Health. They can learn about all kinds of resources available to the book. They can claim their copy for free. We'll send them a copy for free.
Wow, that is wonderful. Such great and important work you guys are doing here. Ed, thank you so much for your time today.
You bet. Thanks for the opportunity.
Make sure to grab Leading Health right now on the website, but we'll have more in Good Day Kansas coming up next.
The preceding portion of Arts and Culture is sponsored by Sunshine Meadows.
Sunshine Meadows Retirement Community in Buhler would love to introduce you to our Selah Memory Care Home, specializing in the highest standard of care for those with early stages of dementia or Alzheimer's. Visit us online or give us a call today.